Welcome to Literacy RX, brought to you by SpeechMED. Hosted by Dr. David Lee Scher, this Literacy RX podcast will facilitate insightful discussions with influential health executives on the newest trends in digital health, the crucial issue of health equity, and the powerful impact of language and literacy on patient outcomes. Subscribe and join us as we delve into exploring how to create healthier and more inclusive communities.
So my name is Dr. David Scher. I am a former cardiologist and chief medical officer of SpeechMED. We are starting this podcast called Literacy RX, and that name derives from the fact that SpeechMED is a technology which has been developed to help healthcare literacy. So our first podcast is going to be one in which we introduce you to SpeechMED as far as what we do, why we do it, and there's no better person to do this than the CEO of the company, Susan Perry. And I'm extremely pleased and privileged to discuss SpeechMED with her today.
Thank you, David.
So Ms. Perry, discuss with us the history of SpeechMED and how it came to be developed, and we'll be getting into the nuts and bolts of it in the forthcoming few minutes.
Well, actually, it started with two hungry ladies. I took my niece to a restaurant. She has Stargardt's, which is juvenile macular degeneration, and I had forgotten my reading glasses, and neither one of us could read the menu. So I started talking to Jess about what she does, and she told me, she orders a grilled cheese no matter how fancy the restaurant was. And I said, that's pretty ridiculous. And we developed the first audio digital restaurant menu in the world, multilingual, called Menus That Talk. Then in 2000, and after that, we were in restaurants, we actually developed one for a hospital system, and went on to do zoo tours. The reason that is important is because we got to look at how people interact with voice and language platforms in a wide variety of areas, and also learned what to do and what not to do with translation, which is a very complicated process. Then my mother-in-law, who was 81 at the time, was admitted to a local hospital, and she was extremely bright, energetic kind of lady, spoke 5 languages fluently. The problem was she only read French well. At discharge, so she went in for a bad cough, and as a precautionary, the doctor thought it was turning into pneumonia, so he kept her a few days. They looked at all her medication while she was there, and at discharge, they gave her the usual 15 pages written in English. The nurse talked to her, I'm sure, but when she got home, they're tired, they're stressed. All they're thinking about is, please give me my paperwork so I can go home. And when she got home, my niece, who doesn't read or speak any English, which is, by the way, very common in the United States, 1 in 5 of us goes home to a family that speaks a language other than English in the home. She went to the pharmacy. She managed to get her new prescriptions for anticoagulant and hypertension medicine, so the blood thinning medicine and the blood pressure medicine that were supposed to replace her 2 old ones, and instead she added them to the schedule. And so my mother-in-law basically was taking double doses of hypertension and anticoagulant. And David, better than anybody what happens when that happens. Yeah. 5 days later, she was back at the hospital. She was in intensive care for 16 weeks. She had dementia as a result of the, accident, the medication mishap. And after she was discharged, she lived another 11 incredibly miserable months and died. And, I wish I could say it was unusual, but it happens A medical mishap due to a miscommunication happens about every 14 minutes in the
Wow.
United States.
So that's very interesting, and I think what that represents is that a lot of digital health technology companies are developed out of what is perceived as a real or need or what is a need from the patient perspective, as technology is adopted by physicians and clinicians and healthcare enterprises, but they don't really have those appreciations of what patients go through a lot of times, because they see the patient leaves, and then something happens. And a lot of times, either the patient can go to another healthcare institution or physician, or they just lose track of things. So, and it's critical. So the fact that this is born out of a need, and it is a real need, is very telling. And because there are a lot of technologies that are developed for the sake of developing a technology, with the profit motive as the prime reason. And so when it comes to solving a problem, technology is much more successful if it's geared towards that. Describe the technology and platform itself.
Okay, so after that happened, we started looking at healthcare because we have this amazing proprietary voice and language platform. And basically it involves an enterprise portal for, providers. It's a patient portal so that when the patient gets home, maybe, for example, from a hospital, they can also add other things. And then finally, a mobile app that is not device dependent. So there's lots of different ways that you can use SpeechMED. And basically it helps you keep track. We don't call it a patient engagement app. We call it a patient empowerment app a lot of times, because it allows the patient to take doctor's instructions, right? A lot of times they're simplified for them. And then they're getting their medication reminders in the language that they understand, and also audio, which is extremely important. They're getting their care reminders. They can keep track of things like allergy or their medication lists, documents that are important. For example, they may want to put a do not resuscitate order that's easily available, COVID card, right? The vaccine card. It also keeps track of things like, previous surgeries, so that when they go talk to a physician or even a new physician, they have that information readily available. And, then the physician can do a better job too, right? Because he may not, I always give the example of the fact that I have TRICARE, and certainly they, keep track of different health records. But when I was up in Minnesota in an emergency, the hospital was out of network, and we requested my records 7 times.
Yeah, that is a known problem.
And so being able to keep track of your health information and also, medication reminders, especially for elders and people that may have low literacy, is a really important thing. So you have it all in one place.
Excellent. So just to review, SpeechMED is really a way in which people can get all their pertinent medication reminders, information, instructions for preparation of types of tests and that sort of thing. Anything a patient needs as a go-to relevant to their healthcare in their language. How many languages or how does SpeechMED's language interpretation work?
So we have 8 right now. We add them as we get requests. It's a long process, probably 8 to 10 weeks, because we don't rely on traditional translation engines. I love Google. I love a lot of the other translation engines, but they cannot provide 100% accuracy for medication reminders. And I don't know about you, but I want 100% accuracy if they're going to tell me what I'm supposed to take at a particular time. The other thing I just wanted to
say, I'm sorry to interrupt, but it doesn't take 8 to 10 weeks for the patient to get that.
No, that's if you wanted to add a new language.
Like, okay, good. I wanted to.
Had a big Somali population, and they would like that. We would have to add that. Yeah, we have 8 standard languages right now, and it covers probably 97% of the population of the United States.
So when a patient is prescribed SpeechMED or recommended to have SpeechMED or enrolled in SpeechMED, which can actually take place either from the patient standpoint or the provider, how long does it take for them to get their information in their language?
Once they're enrolled, and that doesn't take long at all, it's automatic.
Good. Excellent.
And in fact, you can, there are a lot of multi-generational households in the United States where the grandparents may speak, say, Spanish, and the grandchildren do best in English, or maybe there's an in-law that does best in English. If my mother-in-law had gone home with SpeechMED, she would have been getting all of her instructions in French. With one button, I could switch and listen to everything in English. And Maria, who used to help her a couple days a week, could have listened in Spanish. Everybody's on the same page.
Excellent. Who are the potential business partners or clients of SpeechMED?
I think the short answer is anybody in healthcare that provides healthcare information needs SpeechMED for their patients. But we've been starting to work with government entities, primary care centers, hospitals.
And the current political atmosphere and regulatory issues surrounding health literacy, surrounding health equity. These are people that are on the fringes that, because of language or culture, are getting less quality health care and are proven to have worse outcomes. So I would think that SpeechMED would be something that can address this as well.
It does. And in fact, we won an award that we're very proud of from Village Capital for health equity. Our stand is that health equity is about ability. It crosses race and gender and age. It just depends on how well you read, David. And, in the United States, we have a proficient health literacy rate, which is you have to be able to read on the 11th grade level, of about 14% of our population. So everybody else is struggling a little bit, and some people are struggling a lot. There's 130 million people in the United States that can barely understand what's written on their prescription bottle if it's written in English. I mean, it's a serious problem.
And that includes English-speaking people.
Yes, it frequently does, because of their ability to access good education, or that maybe they have a disability. There's a lot of reasons why people don't read well. And yet at every touch point in healthcare, we're expecting them to read well and read well in English. And that's my objection to a lot of even applications that we give patients. You're supposed to read the text, and maybe you can and maybe you can't. And we need to think a little bit about that. I think it's great that hospitals are offering translation in hospitals, and a lot of times in doctor's office. In fact, it's mandated, and hopefully at some point CMS is going to think that they should help those hospitals pay for it. At this point, it doesn't. But what happens when the patient leaves your office?
Absolutely. Yep.
Right? And with medication reminders, that isn't only people that have English as a second language, it's anybody, elders. The other thing that we do that we're proud, we're all in the company, we're all caregivers. And the fact that say you're taking care of your dad in another state. When dad doesn't comply with his medication prompt, then you can get a secure text that tells you, your dad didn't answer his 8 o'clock medication prompt. And it gives you the opportunity to call or check. So it's really useful. The other thing we do for caregivers is audio notes. So we allow the patient, obviously with the physician's permission, like my mother, half Japanese, she would go to the doctor. If I didn't go with her, when she came home, I'd say, "What did the doctor say?" And she'd say, "Oh, he said I'm fine." Right. So instead, "Doctor, do you mind if I just tape your instructions so I can go through them with my daughter?"
Oh, excellent.
And then you put you can label it like saw Dr. Shore on XYZ date. And then if I wasn't in town, she could send it to me securely.
Yep.
And it really helps.
That's awesome. Yeah, I've had my own relatives do that in English, just because they don't. Again, it's a question of health literacy. Whether even if you're college, graduate, the literacy aspect of it really speaks to how well the physician explained things and how it is received and absorbed. So it's on both ends.
And David, don't you think sometimes stress levels when you're talking to a patient, like if you're telling them something difficult, also makes them maybe not absorb all the—
Oh, absolutely. As soon as somebody gets a significant diagnosis, often anything that goes in one ear goes out the other, because they're just dwelling on that diagnosis and ruminating about it. And so a lot does get lost, from that point on. How does SpeechMed interact with, you were discussing how patients can get their instructions and things like that. So SpeechMed can talk to the patient's electronic record, and it's easy sort of in the background that way, or is it something that's done with a process that's tedious?
We hope nothing's tedious. We try to make it really easy. We have the ability with our partnership with InterSystems to talk to about 180 of the most prominent electronic health records.
Excellent.
And pull a lot of that information. And then the patient portal gives, like, maybe I'm a caregiver and I want to add my mother's vitamin and make it a reminder, or I want to add walk for 15 minutes. And I can do that too. And our system archives who puts in the information, when it was done. So we know, oh, this is the doctor's instructions or the, coming from the EHR or from the doctor versus, I've put it in for my mom. So
Excellent. Where do you see SpeechMed going? In other words, what is your wish list about how the technology is used and how we can get this out to other people?
I think our mission is to make healthcare for everyone to have equal access to their healthcare information and remove a lot of obstacles. We would like eventually, it to spread all over the world, because everywhere there's a need for, instructions that people understand. And how can we expect people to be compliant and healthy if they can't understand their instructions? I mean, doctors' instructions are very important to us, right? But if we don't understand them, then we're not giving equal access.
And not only that, but they're literally useless.
Right. And what I find is that frequently marginalized communities, and I don't mean only minority communities, I'm talking about people that have disabilities, people that are elder. There are more challenging patients to work with, and we hope that we can eliminate those obstacles so that they have equal access, because we want everyone to stay healthy, and a lot of it's preventive, right, too. So if we can understand our good doctors and good healthcare professionals' information, then we're much more likely to follow and stay healthy.
Excellent. You mentioned disabilities. How would patients with disabilities benefit with SpeechMED?
Well, classic example, my niece Jess, who has Stargardt, so she can't read. I mean, very limited reading because she only has peripheral vision. We do it in an audio format. Audio is so important. It's one of our first, learning to read is something that socially we've developed, but our brains are not necessarily hardwired to be reading. However, the minute when a baby's in the womb, even they start responding to sounds, and everybody talks about the fact that dad will speak in the delivery room and the baby turns in their direction, right? Because we are listening, and we're listening people. So a lot of times taking in information through our ears, and we also, it is printed on the app if somebody wants to do that too, is really important. And then, of course, if we can deliver it in the primary language that we understand the best, it's a winning combination.
So people that are sighted, that have sight disabilities or have problems with that, can get this in audio form, and that's
right. And the other thing is, if we have memory problems, we can re-listen to our information.
Excellent.
Many times, right?
Excellent.
So there's a reinforcement of that. And we're working on technology that I don't want to really give away, but it'll make listening to it a lot easier.
Good. Everybody has a V2.0.
Yeah.
So I'd really like to thank you for being on the podcast today. Any last thoughts?
I think we all need to join together and try to reach out so that everyone has equal access to healthcare, and we can relieve, our physicians with some of their, I know they must go home at night and worry about the patient that they're not sure got it, and they don't have a lot of time. So if we can relieve that workload, if we can have people have equal access to their healthcare information, then we don't leave anybody behind.
Good for you. I want to thank you for being here today, and thank you for having us launch this podcast. We're going to have future podcasts with very well-known people in the space of digital health and healthcare itself, and look at their responses to what ails the healthcare system and how SpeechMED can fit in. So I want to thank you very much, and have a great day.
Thank you, David. Thank you. Looking forward to it.